Good afternoon, everyone, and welcome to MedLern webinar series. The topic for today's webinar is Innovation and New Trends in Trauma Care. We also take this opportunity to announce the launch of Emergency Nurses Association Trauma Nursing Core courses in India. This is the agenda for today. India struggles with the highest fatality rate in the road accidents in the world at 25.3 per 10,000 vehicles. The burden of road traffic accidents continues to increase at an annual rate of 3%, leading to disabilities and fatalities, and the consequent social, emotional, and economical losses. However, most of these fatalities can be avoided if action is taken at the right time. Pre-hospital care is a golden hour where decisive actions can improve chances of full recovery. It is virtually non-existent in rural and semi-rural areas. Even in the larger cities, pre-hospital care services are largely lacking. Now, State Medical Council and the Nursing Council control the education and licensing requirements of physicians and nurses. However, formal education and specialty training in emergency medicine, in trauma surgery, in critical care are not mandatory for personnel who are involved in trauma care, and it is available only at select institutes. Now, the Academy of Traumatology India has, to some extent, standardized education in trauma life skills through their National Trauma Management course. However, this training is available mainly in larger centers, and that too, it's only for doctors. There's a need to strengthen the trauma care program in India, and there is a need for robust training programs for nurses and for trauma response teams. Emergency Nurses Association is a prestigious professional nursing association that is dedicated to defining the future of emergency nursing through research, innovation, and technology. ENA was founded in 1970 and has become an indispensable resource to the global emergency community. It has more than 50,000 members worldwide. ENA advocates for patient safety, it generates its own practice guideline, and it guides emergency healthcare public policy. And it also sets the standard for quality, evidence-based nursing education. Now, ENA is committed to all aspects of emergency healthcare by keeping the nurses updated with the best practices. And goal of ENA is to ensure that nurses and hospitals have an access to reliable, relevant education that will help the care teams to stay at the forefront of this rapidly evolving specialty. Now, with this commitment, ENA has collaborated with MedLern to bring to India its trauma nursing core courses. This program offers evidence-based nursing care in trauma care for adults, pediatrics, geriatrics, advanced trauma nursing, and triage. Let me introduce you to our eminent speakers who will be talking more in detail about this program. Our first speaker is Deepak Sharma, who is Chief Executive Officer at MedLern. He is a graduate of IIT Delhi, and I am Calcutta. And has served in several leadership roles in the technology industry, including as CEO of State Street Global Advisors in India, and more recently leading the strategic initiatives for Wipro, including marketing for their healthcare and life sciences business and their products and platform portfolio. Deepak is going to talk about how MedLern over the past 2 years has become the trusted learning partner for hospitals and for healthcare professionals. Our second speaker is Terence Kais. Terence has served as a Chief Growth Officer of Emergency Nurses Association since February 2014, and he is responsible for business development, sales, marketing, PR, communication, and the ENA Foundation. Terence also plays a key role in ENA's international strategic partnerships. With more than 20 years of experience, he has spent most of his career in healthcare and human services. Understanding the many challenges that exist in healthcare, he continues to work making positive impact and services through ENA. Terence believes in the old cliche, to whom which is given, much is expected. Terence is going to introduce us to ENA and also talk about the global strategy of ENA and its plans for India. Our third speaker is Katrina Cisse. Katrina is the ENA's Director for Educational Content. She is a lifetime member before joining ENA as a staff nurse, and Katrina has been an emergency nurse since 1995. Precepting nursing students sparked a passion for education early in her career. Her experience in staffing and teaching at level 1 trauma centers, at community hospitals, at international hospitals, and critical access hospitals, specialty cardiac orthopedic hospitals have provided great insights into the support needs of emergency nurses. Her master's thesis was horizontal violence in ED, and Katrina is honored to serve the disciplines she so loves. Katrina will be talking about the trauma care program, how it is going to help nurses to deliver better care, and also how it will benefit the hospitals. Our fourth and the final speaker is Dr. Matilda Vincent. She is an associate nursing superintendent and academic skill trainer at PAS Medical College, Chittoor, Andhra Pradesh. Dr. Matilda has done her BSc Nursing, MSc in Medical Surgical Nursing, and PhD Nursing. She has done her certificate course on quality management in healthcare, and she will be talking about the need to strengthen trauma care services in India. So a very warm welcome to all our speakers. Over to you, Deepak.
Thank you, Dr. Venu. If you could just switch me over the host, I will. What I plan to do over the next 4 or 5 minutes, or maybe even shorter than that, is basically introduce MedLern to the audience. We have a lot of audience here. I think we have a full house, and a lot of you are familiar with MedLern because you come from the community. MedLern is now in more than 200 hospitals and with 50,000 healthcare professionals in India and Asia as their preferred learning platform. But there are a lot of new people on the call. So I'll take a brief moment to talk about MedLern, what we're trying to achieve, a mission for the next few years in this segment. I'll briefly, very briefly, because there are lots of eminent speakers following me and Dr. Venu has already said the context, briefly introduce the relevance of the programs we're introducing today, and I will let Terence take over from there. So let me see if I'm ready to share the screen. Just one moment. Yes, there we are. Just a moment, please. Everybody can see my screen? Yeah. All right.
Yes,
okay, great. So as I said, very briefly about MedLern, we started this journey 2.5 years back. We are aiming to be the complete skilling and training solutions for hospitals, and really part of that in the subtext is also the preferred lifelong learning partner for healthcare professionals in the region. We started this journey, as I said, about 2.5 years back. We had an official launch 2 years ago on end of January, just before the pandemic hit. We already in more than 200 hospitals and serving 50,000 healthcare professionals in India. This list is growing, but our solutions relevant not just for any specific kind of hospitals or healthcare institutions. We are now serving hospitals which are specializing in specific areas: tertiary hospitals, secondary hospitals, large and small hospitals in not just in metro cities, but also in smaller cities and towns across the country. These are some of the names that I said we keep growing. For those who are familiar, these are good brand, but they're, this keeps getting added every day. We've got Beach Candy from Mumbai just signed up. Hopefully next time we meet, we will have that iconic hospital also as part of the logos displayed here. If we briefly talk about the mission, right? So where did MedLern come from? We are on a mission to change healthcare in India and Asia while lifting the quality of training and skills provided to the healthcare workforce. We believe there's a lot of potential in the market. It's so far been held back because of this constraint on the availability of skilled medical professionals. The education system has been gearing up, but I think it's nowhere near prepared to keep ongoing education and skilling going because of the rapid growth of the sector. The mission came from a realization when one of our own colleagues in Impulses lost his life due to a medical accident on the dental chair. And that's where the MedLern idea was born many years back. We are now obviously much more broader than just patient safety, etc. But let me talk a brief about the two major markets we serve: healthcare providers and hospitals. This is a promise, really, to meet today's challenges of delivering superior patient outcomes, compliance, risk, and employee retention. We believe these are the challenges that every hospital, small to large, primary, secondary, tertiary, are facing every day. And this is the need of the hour. And one of the critical resources for meeting this is the skills and the training provided to their employees. The uh, the more longer term outcome is to achieve tomorrow's promise of better care outcomes, patient experience, and becoming trusted brands. Almost all hospitals that we work with realize the promise of the literal revolution that's happening in the Indian healthcare sector at all segments. There's a medical value tourism. There's a large growing payer market with insurance being provided by employers, which is growing significantly, not just for inpatient, also outpatient. There's growing need in the middle, mid market to, look at wellness, and there's a lot of increasing focus on healthcare as well. There's also a significant government initiative coming in to the likes of Give Bharat PMJ Yojana, which is the equivalent of in large markets, in the US market of Medicare, Medicaid. There's a significant growth promised, but as I said, the availability of skilled, motivated healthcare professionals remains a challenge, and also with the fast growth post-pandemic of new trends, new developments, new technologies, new protocols, digital telemedicine, and an ongoing need to just stay current and continually upgrade skills has left the skilling market behind, and the education system still catching up. The other side of the coin for MedLern is a promise to the healthcare professionals, which is a lot of people on this call today, right? This is our promise to you. We help you build rewarding careers by providing world-class learning content delivered at your fingertips. We promise to be a lifelong learning partners to guided, personalized skilling journeys. And as we go together, as we achieve the common good, we believe we will achieve social goals as well as the business goals that the healthcare sector needs to achieve in the next few years to deliver the quality of care. We have traditionally, having been incubated at Impulses, which is an expert in SaaS-based content learning solutions the last couple of years. Globally, we've forged great partnerships over 2 decades. Some of these names out there, they're already collaborating with MedLern, the American Heart Association, and Laerdal are jointly launching our instructorless, contactless CPR solutions this month, which is being launched at the Geneva Hospital. Some of the other providers that we worked with, content learning providers, their content, their learning courseware is already on MedLern. Royal College of Nursing UK is again one of our key partners we launched last year. So a lot of these solutions specifically targeted for the healthcare segment to fill in the gaps that the Indian market faces have already started with a journey a couple of years back. But today is a huge significant step forward as we launch our partnership with ENA. This is fructified recently, and we are very, very proud of this major step forward, because we think this fills a critical gap both for providers and professionals to bring this very, as Dr. Renu said, life-saving capability into the market, to be able to provide well-researched, tested content delivered effectively through MedLern to the segment. This complements very well our focus on the recent partnerships announcements. We said we've launched the resuscitation solution, which is basic life support, advanced cardiovascular life support, and PALS in collaboration with the American Heart Association. So this is literally another very, very critical part of the same chain. These are essential skills and qualifications for the nursing segment in the market, which has been sorely missing. It's been, there are obviously, there's a large community of emergency nurses and trauma care nurses in the country, but this has been a significant gap in the availability. I will, again, there's a lot more coming, so I'm just not going to spend that much more time. The 3 segments for nurses, for emergency departments, and for hospitals overall, where the new program is going to be supremely effective. For nurses, the program will help them stay updated on the best practices, advance their career, especially the ones who aspire to make career in emergency medicine and trauma care. Emergency departments within healthcare systems or outside programs helps to meet the staff's personal development needs, from nursing orientation to advanced practice. ENA's offerings will provide a wide range of programs to support delivery of quality care and improve patient outcomes. And for hospitals overall, it ensures that the nursing team has the knowledge and skills needed to manage emergencies while facilitating transport to the ED or for a higher center of care. So I'm just going to leave this here, a very high level summary, because there's, great speakers to follow. I want to especially thank the speakers. It's really good to know that both Katrina and Terence are somewhere on the late time zone. It's 2 a.m. in the morning there in the US where you are. I'm very grateful that you could take the time to address our audiences, and they're eagerly looking forward to whatever you have to share. So with that, I'm going to hand it over to Terence. Terence, I'll stop sharing and make you the host. You should see the prompt in a minute.
All right, let's see if I can.
There you go. Thanks, Terence. Are you able to?
It's coming up here. Do you see the presentation there, the first slide? Great. Appreciate that, Deepak. I think, you sort of set the stage really well, in what you set out, and the partnership and the things that are important to you all are those same things that are quite important to us. So I'm going to go through several slides. I'll work very hard not to bore you and hopefully keep this interesting. All right, you see the overview slide here, and so just really wanted to give you a sense of what I'm going to cover, much how Deepak did. I'm going to give a quick overview, then touch on education a little bit, because Katrina will take us down that road. Some of the market drivers, and then ENA membership market drivers, I think is important, and then end with upcoming initiatives that we have. I think it's important to start with our mission, vision, and values, because it's what really guides us as we do our work every day. And I thought it would be important for you to at least have some sense of what's important to ENA: collaboration, compassion, diversity, excellence, lifelong learning, which is something that we're working through with you all. The culture of inquiry, we believe, is really important. Integrity, and of course, the spirit of philanthropy. Our core values within our strategic plan center around integrity, diversity and inclusion, collaboration, and excellence. So all that we do, we work to center around that, and we believe we have a great partner to further that. Another piece I wanted to share, I mentioned the spirit of philanthropy. Our foundation, I think it's worth noting that we provided more than $5 million in support for scholarships. Those scholarships are open to all. not just those in the U.S., not just those that are members. And so would encourage you as we engage to take advantage of that. Some of those are educational scholarships. Some are, we do scholarships for conference to come to the international conference that we do have. So just wanted to share that with you. But worth noting, how many members do we have? DNA has more than 53,000 members. We've hosted more than 1 million students and verifications, which we're extremely proud of. Really speaks to how this course, the courses appeal internationally. And so we're just super proud of that, and keeps Katrina and her team quite busy. Wanted to share a couple things that we've found around educational needs and why folks want to engage. Why do nurses engage? And just a little something here, probably needs no explanation, but at the end of the day, you want to keep up with the best practices that are out there, and we are that resource to be able to do that. To earn a certification, that in some cases it's required for people to take certain courses, and we think again, ENA and our partnership here is going to allow that and be fantastic. And a piece that I think is really important, there are many times where people see the nurses are sort of task workers. We believe they are critical thinkers, and so part of that is about critical thinking and decision making being very important. Couple courses I'll just mention again, because you'll see these likely with Katrina, but our Pediatric Course, EMPC, is one of our courses around trauma. And then you have your trauma nurse course for adults, Tncc. Again, really excited about that. Those two courses and what they bring to nurses. And again, Katrina will likely touch on some of that. Another area for us that is really important is quality, safety, and injury prevention. There are many of those that could be injuries that could be prevented. We'd like to see that, but it's all about our quality and safety. And so as we move forward, that's an area of resource for us. You have position statements that come up, toolkits that we do, clinical practice guidelines, which is very important to the nurse. So we like for folks to be able to take advantage of those resources that you get through who ENA is. I'll be glad when I don't have to list COVID-19 resources, but that's been sort of a reality for us. Another area of importance, I think, with ENA is our research. We are, I think, probably one of the only nursing organizations that have its own research team and professionals and nursing professionals that do research, and something we're very proud of, and we like to see more nurses engaged in research, and we're very proud of that area that we do. So when you think about market drivers, what's changed or what's happening inside of nursing, and I think you kind of mentioned technology and what does that mean, whether it's online education, mobile applications, there's just digital has exploded. Prevention has been something that's been a huge trend, and then when you think about education, the shortages with nurses has been something that we've dealt with worldwide as well. So we're seeing lots of trends. I thought this would be interesting to share with the group, what folks thought was the greatest challenge or impact, and not just folks nurses. And sort of the top 10 there is pretty visible, but the burnout, this pandemic has taken a lot out of folks. And so how do we continue to support the nurse bedside? how do we support the management, and how do we support the hospital? So I think I really like that slide that you showed there, Deepak, on that, because we believe those are areas that ENA definitely can impact. Give you a sense of what's happening in the U.S. as far as visits. You know, over 130 million visits. 35 million injury-related visits. Again, so when we think in terms of why is injury prevention so important, that critical care component. So I just thought that was worth sort of sharing with you to give you a sense of the large amount of people that we're seeing. Even when you think about how much time, 15 minutes, 43% of the people are seeing less than 15 minutes. So it's really important how we are bringing people in the emergency department and moving them out. So that is one of those that I think is really important. I just thought this would be interesting, probably no surprise on what the age and gender looks like within, nursing in particular. So I just thought, when we think about it's getting younger, and so that's requiring us to do a bit more. You're finding, at least what's happened in the U.S., you would, I think, probably 5 years ago, maybe not even that long ago, you wouldn't bring a new nurse into the emergency department. And now, because of the shortage, you see that more are coming in, and so education is just critically important. That's one, when we think about our membership, the value prop for our members, education, networking, and advocacy just happen to equal ENA. But it's a critical piece for us. And what do our members really, when we ask our members, what do they see as the primary value? I wanted to share this, credibility and expertise. Again, we believe and know that our emergency nurses and professionals are critical thinkers, and their expertise is a critical component to the care that's taking place. And that, I think, is really important. Looking at some of the top reasons why they also join, stay informed on the latest trends and developments, and taking advantage of educational opportunities. It's something that I think is really, we believe that you need to have that network. And so, ENA provides that for you. Resources and programs that we believe that will help with the trends. We believe we need to advocate for better workplace conditions, whether that be nurse-patient ratio, whether that be educational resources, but we have a place and a responsibility to help with that. Upcoming initiatives, that are happening. We started ENA University, I think it was maybe late in the year last year, and it's been going great. Now we have a residency program that we will have come out. We're really excited about that. The pilots that have worked, it's really given us great feedback on what that means. And then we have new additions coming out for ENPC, and we're launching a DEI research fellowship. We think it's important to ensure that we are engaging on the diversity, equity, and inclusion. So we have a research fellowship, and that's a new thing that we're really excited about. Globally, what do things look like for us? I mean, we are all over the world, and we are very excited about that. It does make some days a little longer when you're up early and doing presentations, but it's what we love to do. But very proud of where we're at, and look forward to increasing that, certainly through this partnership that we have. And that's what I have to share. And I do believe at the end of this, we'll be able to have questions at that point. And I think I'm turning it over to you, Katrina.
Yes, Terence, we'll have to make Katrina the host.
Mm.
You have to just click on Katrina's name, more, and make host.
Here we go.
Yeah, thank you so much.
Thanks, Terence.
Thank you. Thank you. Can everybody hear me? Okay. Wonderful. Well, thank you all for being with us. It is really an honor to speak with everybody across a enormous geographical area. So I'm very thrilled to talk about just the power of education and what I personally have seen by both teaching and learning and working with the people that I've had in my courses, the courses that ENA has taught, and with trauma care in particular, what we have developed with a systematic approach to care of the trauma patient that can be so useful when you've got a trauma patient that is just a mess, you don't know where to make sense of it. And the systematic approach that we use in all of our trauma education, that we use also in our pediatric education and our triage education and our geriatric education, that really translates and it helps nurses have something to fall back on to be able to prioritize their assessments and interventions. Again, having worked in the emergency department for years, I do still staff, and having taught our courses for years, it's the impact of that and how much I can see it at the bedside, the difference that it makes in how a nurse feels confident to take care of patients, can use an organized approach. It's just amazing and it's an honor. So I would like to say that the Emergency Nurses Association, all of our education is developed with very high standards. So the American Nurses Credentialing Center accredits us to provide nursing education that provides, we call them contact hours or CNE, continuing nursing education. The new term that I think is global is nursing continuing professional development. So all of our courses are developed with a very high standard of making sure that we're addressing something that is relevant. It is a practice gap. It is something that nurses need to better take care of patients. And along with that is a commitment to making sure that our courses are effective, that we're really measuring learner outcomes. And if they aren't meeting those outcomes, how can we make it better? So it's a partnership between how we teach, how we develop that education, knowing that we're adults and adults learn differently, and then how to make sure that it's effective, that you can translate what we're teaching to what we do at the bedside to take care of patients. So I mentioned the systematic approach. Back in the 80s, they recognized that trauma nurses aren't necessarily equipped at the time with a systematic, organized approach to deal with, again, that messy trauma patient. There's blood everywhere, the patient's screaming, you don't know how to make sense of it. It really helps to have this approach to fall back on. And all of the courses that I'm going to talk about use what we have called the trauma nursing process, but we really apply that to every patient. And when I teach nurses that are in intensive care units, in the operating theater, and in other areas than the emergency department. And this systematic approach can be really useful to make sense out of any patient that you're not sure what's going on. What do I do next? How do I prioritize? And this assessment process, we're real big on alphabets in mnemonics and what do we do next? It's based on A, B, C, D, E, which many courses are. So it follows along with that sort of prioritization, but very specific to the trauma patient. We also have it specific to the pediatric patient and to the geriatric patient. So all of our trauma courses and, like I mentioned, other courses follow this trauma nursing process. So as learners go through our courses, this is reinforced in every course. Again, having that in the back of your head to help prioritize when you really don't know how to make sense of what's going on in front of you, falling back on this and, all right, this is crazy. I don't really know what's going on, but I can remember A. I can remember alertness and airway. I can remember breathing, and being able to focus and then repeating these assessments. What do you need to look for? What would be a life-saving problem that we need to identify in that primary survey, and then what's a life-saving intervention that we need to initiate. And this is all done within the context of a team approach. Emergency nurses work very closely with physicians, with paramedics, with technicians. There's a lot of different players in the emergency department, and this is really designed that we all are speaking the same language and know how to prioritize, and we're on the same page, so we are not kind of running around each other and all thinking we need to do different things. This really keeps us on the same page, making sure that we know what the priorities are and what we need to do next. So we have our introductory courses. So we have 3 of them. There's the Introduction to Trauma, and that the one is caring for adult patients. There's the Introduction to Trauma caring for pediatric patients. And then there's another course that's Introduction to Geriatrics. It does involve trauma, but it also involves medical conditions in how to care for patients. Each one of them uses that A through J approach for how do you approach your trauma patient? What are my initial assessments? What do I need to look for in that patient? What is abnormal, and what is abnormal that I can do something about right now that's going to save lives? So it's all part of what we call ENA University. And ENA University is our online learning management system. So many of our courses are available at your convenience whenever you want to do it. If you're awake at 2 in the morning and have 20 minutes, you can come on and do a little bit of education. So these are the individual modules in the Introduction to Trauma Caring for Adult Patients. So the one that I showed you the picture of was Amputation. It goes through a case study. As you're going through the case study, it's asking you, what is the airway assessment? What is the breathing assessment? Calling out abnormals in the steps of the trauma nursing process. And then, all right, this is what you see. What can you do about it to make it better? And helping, again, prioritize, what do I need to look for? What's abnormal? What can I do about it that will help my patient? All of this is really done to help optimize patient care. And again, within that team approach, if multiple nurses have taken this, and again, I've seen it with my coworkers that have taken these courses that we create, we're in the room with chaos going around us, but we're all speaking the same language. We're working together, we're working in tandem. We know what to do because we've had this really standardized education. So we have those introductory courses. We also have our 2 huge courses. They're awesome and amazing. So there's the TNCC, which is the Trauma Nursing Core course, which we'll talk a little bit more about today. There's another course called the Emergency Nursing Pediatric course. They're both set up almost identically. One is about the care of the trauma patient. The other is about the care of the pediatric patient. There is a section within TNCC that talks about the pediatric patient. And there is a section in ENPC that talks about trauma. But they do complement each other very well. And they are also based on that systematic nursing process. What are your assessments and interventions? The difference with ENPC and TNCC is they are instructor-led. So a lot of our education is online. It's very convenient, it's self-paced. We have wonderful instructional designers that work with, it's not just listening to somebody talk, like unfortunately you have to listen to me now, but it is doing things with the content. So there are interactions where you have to apply that trauma nursing process. So then it imprints it into your head. So when you go to the bedside, it's there, it will be applicable immediately. This is an example of our checklist. So that nursing process, this is specifically for pediatric patients. There are specific skill steps that we go through, and we use case-based scenarios, just like we do in the introductory courses. There is a patient scenario, and it goes through the entire nursing process. What do you need to look for? What do you need to do? And what are your actions at each step of the way? And really, how do you prioritize to make sure that you're not missing life-threatening bleeding, that you're not missing, they don't have an airway, so they aren't going to be able to get oxygen in. And then what can we do about that to help that patient? The course format, and this was a course I was able to participate in Bermuda. That was lovely. This is an in-person format. There's in-person and there's also a virtual option. But for either option, there is some pre-course work. So there are online modules that help the nurse come to the class more prepared to participate. There is a provider manual. You saw those books so that you can read through the book. I'm really excited. Again, part of our commitment is to make sure these courses get better. So we revise them about every 4 years. We also keep tabs on them in those 4 years, just in case there's some advance in practice that we need to incorporate into the course. So it's always evolving and making sure that we're staying at what is the best recommendation for care of patients. The committee, it's all education for nurses by nurses. There's a committee right now that's in our office that is working on the 6th edition of the Emergency Nursing Pediatric Course, and they've got some amazing ideas of how to make it more effective, more fun, more engaging for the students. And that part of that involves that pre-course work, really looking at what can we do to help prepare students to really participate in class, already have a solid working knowledge of the basics of the content, so that when we start talking with them and using that instructor-led time, they can really take advantage of it. At the end of about 12 hours, and it can be done in a few different formats. It can be done in a day and a half, and a lot of places will do it in a day and a half. We do not recommend that it's done in one day. That is way too much. I know I'm used to working 12 hours in the department, but 12 hours of trying to learn, your brain has limits. So for virtual format, we usually recommend that it's no more than 6 hours, and recommend even actually shorter than that if you can manage it. But it's very flexible as far as the course format with the instructor led. The pre-course work, it's all at your own pace. You can do it whenever you want it. It's online at your own pace. You can go back and look at it whenever you want for 4 years after the course. During the course, we have some group discussions, some games, but a lot of it is we have what we call either the TNP, trauma nursing process, or pediatric nursing process case scenarios, where we take a case, we use that black and white checklist that I showed you, and we talk the students through a case and tell them what they're seeing, what they're learning. There are some places that teach our courses that have a very high-tech simulation lab with the mannequins that can breathe and all of that. I have also taught with no mannequin and had maybe like a couple of towels that are looking like a patient. So it's very flexible as far as you don't need high-tech stuff to be able to teach the course. Some visual that looks like a patient helps, because what we're really teaching is the process. And again, what are you looking for? What are the assessment criteria that you want to call out? And then what can you do about it? What do you need to anticipate to make sure, again, identifying life-threatening injuries or abnormalities, and then implementing life-saving interventions. With both of these courses, there is an exam component. So we do 6 practice scenarios in class. Each student will be able to, in a very supportive environment, run a scenario going through that whole airway, breathing, circulation. And at the end, there's an exam, a practical scenario test with one student, one instructor talking through a scenario. And we have that skill step rubric really to make sure that they are understanding the process, that they are doing things in the correct order. And then after the class, you would have a week to do this online examination. Some places will do the online exam right that day, but it's meant to be done open book. You do have to do it in one sitting. It's 2 hours, there's 50 questions, and you can have 2 attempts if there is some reason that you're not successful in the first attempt. And again, you get a week to do that. There is also a virtual option for this. So the courses had been done in person for years and years, since the 80s when they were created. And we were already thinking that we would like to have a virtual course option because it is very possible in a format like this that we can talk through those scenarios, we can show videos, we can have discussions. We do have with these courses, there is always one instructor to at most 6 students. So you aren't talking to 400 people at once. It is very interactive, because with those case scenarios, we need to make sure that we're providing guidance along the way. And it's with a real life patient scenario, we as the instructor talk through what they're seeing. So the interaction is really important and very key. So, and you can maintain that in a virtual setting. So instead of having a mannequin on a stretcher that you're looking at in front of you, we have a virtual mannequin. We can drag and drop some pieces of equipment over, really as a visual. The instructor actually does the manipulation of all the equipment that you see there. But so the student, as we're talking through the scenario, the student has a visual of what's happening with the patient. But it's really talking about the nursing process and the critical thinking of, next, I need to look at their breathing. What's the quality of their respirations? What's the rate? So talking through that, and it works very well in a virtual environment. We've been doing that since 2020. Guess why? We were able to do in-person classes. And now about 20% of our courses are in the virtual. They're done virtually with the instructors are in their homes, their students are in their homes, and they do it all online. Again, the scheduling of that time, that 12-hour instructional time, can be very, very flexible. At the end of either course, either the TNCC or ENPC or our introductory courses, there is a certificate that you receive. With TNCC, it's actually 18.25 contact hours now. Again, we're always making little improvements and tweaks. So every person who completes the course, so you participate in the entire course and complete an evaluation, you will get a certificate with contact hours. And again, these are all accredited by the American Nurses Credentialing Center. After passing the exam, you also get a card that says you are verified as a TNCC or ENPC provider. That means that you've passed that skills test, you've taken the exam, and you are verified as a provider for 4 years. And after 4 years, things have probably changed in pediatrics or trauma, so we would recommend that you do a refresher to take it again. We do have options to do not that entire 12-hour. You can do a refresher. You can either challenge and just take the exam, or you can do a shortened course to maintain your provider status if you would like. So that I could talk about this for a long time, but I know everybody has other things to do today. So just kind of in summary, we have our introductory courses, and each one of them is scenario based at your own pace. And they each offer the contact hours. So they don't offer a provider verification card. There are knowledge checks along the way, but there isn't an exam or an assessment that goes along with that. So, but you do get a contact hour certificate for each of those courses. And then if you're intrigued and want to know a little bit more, there's the ENPC or TNCC course. Again, pre-course modules, about 12 hours of instructor-led time, and then an exam that can lead to a provider card saying that you are a ENPC or a TNCC provider for 4 years. We also do work with, that course that I was in Bermuda, we work with a lot of different countries. ENA can run these courses for you. So if you have 4 students that are interested in taking these courses, ENA can coordinate the instructors, get you the teaching materials, they'll figure out a time for you to do this. And if you've got 4 students, we can run that course for you. We can also help people learn how to teach it themselves. So lots of different options. Again, can be bite-sized, small 2.5 hour courses that all build on that systematic assessment. And I can't emphasize enough how much just having that common language, airway, breathing, circulation really optimizes patient outcomes, makes such a difference at the bedside, really increases nursing confidence in how to take care of patients and enhances our ability to work as a team. So I am going to stop sharing and hand it over, and I'm looking forward to questions at the end. Give me just a moment. All right, you should be the host now and ready to take over.
Yes.
Thank you, Catherine. Richa, can I start?
Yes.
Your mic is muted.
Yeah, sorry. Yeah, you can.
Thanks a lot. Thanks one and all. And I'm immensely impressed that you people are starting your trauma care nursing services in India. I'm proud that I'm the part of nursing fraternity and I'm representing of nursing fraternity of our Indian people. And I'm welcoming you all for this session and in inauguration of this emergency department course, a part of nursing care and trauma care in this India and strengthening the trauma care services in India, right? And thanks one and all. At the point of our discussion, really, the trauma care as such is, core value for the nursing. And it's the key point that, so many of us don't know about trauma, how to go about. And we all know that at a basic nursing care and about, emergency nursing care and about critical care and all those things. But as such, trauma as the strength of our nursing art. The point for our discussion today is a strong pitch for strengthening trauma care system at the hospital to ensure early rehabilitation of road traffic accident victims in view of saving the life and reducing the severity of the patient's impact towards trauma. Next slides, please. And as you see, the first walk-in people to rescue is a nurse. If our nurse are not trained enough or they don't know about to take care of a trauma or to take care of a trauma victim, it will be pathetic. It's a trauma care is art of nursing. As I said, that's one of the art that everybody or the people who are interested to learn about trauma care is the pathway that our ENA has launched today. I'm wishing once again for the opportunity given and the launching program of this. And for this, we should strengthen our trauma care system and provider rehabilitation to minimize the, both physical and psychological trauma. Talking about physical trauma and psychological trauma as such is, we can talk about an emergency department too, emergency care too, but more so ever a trauma. Trauma is not only physical as such for the psychological trauma too. And second, somebody can move the previous slide, please. Yeah. The ENA is offering the course of training and imparting the knowledge of trauma care in nursing. That is what the art says. The nursing art says you learn and impart your training and impart your skills and improve your skills. That is what is the sense of this program. Kindly, the people who are interested in this course, kindly join and improve your skill and take part in the program and improve your skill to save life and both physical and psychological. More of physical and trauma of emotions too. And we talk about trauma in India. There are acute shortage of manpower. We actually had, we have facilities, but to take care of people, they have to learn about trauma. That is what this course is all about. So with acute shortage of program or acute shortage of nurses to handle this trauma, we have to learn trauma care. And this is the program to giving you the platform to handle the trauma care. And people, please kindly ensure that, those who are passionate towards your nursing career to strengthen your nursing career in a particular field. So kindly do that, handle the trauma care. How about what Katrina said, they have a program scheduled for, starting your program career of your program, the hours of program, how it is important, the management which are there used, and all those things are part of everything. And it is basically the evidence-based, not that, we are taking a certificate course and, imparting the certificate. It is evidence-based that every nurse who, being a nurse, to understand how important the nursing is, how important the art of nursing, and how important how you are developing the skill to impart in your career, right? And the more so ever, the standard of quality is based on the art, the way you're presenting yourself, the way you're assessing the patient, the way you're taking care of your patients. And all about this is evidence-based. That is what we are trying to impart in this program, and ensuring that most of our nurses are welcoming for this program. Make sure that you are part of this, and make sure that you are improving in your trauma care nursing specialty and getting the certificate. Not only getting the certificate, and get into this program and get into your practice as such. Second slide, please. To take home, so not much to talk about, because we already know about emergency nursing, but as such trauma care, we have to, because it is merged with emergency and accident, and as such separately we don't have trauma care nurses. We do have in a separate a few places, but the nurses who are trained are along or pathway towards emergency nursing care. So with this scenario in mind, MedLern is offering, or Emergency Nurses Association is offering this course to improvise a skill and trauma care. So that is what we expected you people, those who are participating in this, to take this program seriously and think about your future. It's not only certificate, your passion. See, now every field has got a specialty courses where every individual has a passion. See, me as a nurse, take me as an example. I am very passionate towards critical care. Critical care is my passion. So that is what, every individual, every nurse will be having some specialty or some passion towards, specialties like, critical care, palliative nursing, ortho, and medical specialty, some surgical specialty, oncology. Likewise, the trauma care also is a passion for a person to improvise on the skill, right? So every person who's hospitalized or pre-hospitalized, you need to learn about trauma. It is not only, whatever, we receive a patient in hospital settings and we take care of the patients, assess the patient and go on with that. But this trauma care starts from pre-hospitalization itself. So it's a special course, and it's a key point to take home that every individual passionate nurse who's interested in trauma care should participate in this program or in this certificate course to improvise your skill and knowledge. Next. And I wish everyone to stay blessed and stay safe and do no harm to everyone or anyone too for that matter. And once again, I thank you for the organizers to giving me the opportunity to ensure that our Indian nurses are to participate in trauma care, and will ensure that few nurses, or at least few places who are interested to participate in this certificate course to improvise our Indian view of trauma.
Thanks so much, Dr. Matilda. And
thank you so much.
Yeah, and thanks to all our speakers for a wonderful session. As Dr. Matilda said, this is a great opportunity for nursing professionals in India. ENA is offering different levels of courses, right from introductory trauma care to triage, and comprehensive training programs that are instructor-led. So these different levels of program actually make it possible for nurses, like nurses who wish to take up only basic courses. They don't want to go in depth, can take up the introductory courses. And the ones who want to pursue a career in trauma care as a specialty can also take the comprehensive program. So the wide range of courses gives the flexibility to the learner to choose and pick whichever course they want. And for more information, you can write to us at info.medlearn.com, or you can visit our medlearnstore.com, and there you can see the different offerings from ENA. Now we'll move to the Q&A. Yeah. So our first question from the participant is that what is the duration of TNCC course? So if someone buys this course, what would be the typical duration of the course to complete it?
So for the introductory courses, they're about 3 hours. So there's different modules in each one. Each module takes about a half an hour to complete. And the contact hours for that, the courses do expire. Those courses expire in December. However, as part of our accreditation process, we continually look at the evidence and refresh the courses. So the course expires, but the plan is you will still have access to that course, because we will just look at it, do a review of literature, make sure the course reflects best practice right now, and update it. So it has an expiration date listed when you look at it on a website, but that doesn't mean that the course goes away. It just means that's when we look at it again and make sure that it still reflects best practice. So the duration of the courses, to take it, it's about 2 to 3 hours for the introductory courses. The contact hours themselves don't expire. The full courses, the instructor-led courses, it's about 2 days of work. And again, the contact hours don't expire. We're renewing the 6th edition of ENPC will launch in October, and the 9th edition of TNCC will launch in April. But if you take it before then, you still have your provider status and your contact hours for 4 years. I hope that answered the question.
Yeah, Katrina, thank you. Another question is, how would this benefit to those aspirational people who wants to settle in other countries? Will this certificate have value for nurses looking for overseas placements?
Yes, that is, I don't want you to leave though, because you've taken these, just saying, but it is an internationally recognized course. So you can have your ENPC or TNCC provider card or the contact hour certificate. Those are internationally recognized.
Okay. And Katrina, what if the learner is not able to clear the exam? What happens then?
So there are a few options. You will get the contact hours anyway. So whether or not you pass the exam, you will get the contact hours. You can retake the course. So the practical skills exam, you have 2 attempts to take that as well. That one you need a 70% to pass, and then there's critical skills, like you need to make sure you have addressed circulation and assessed a pulse and made sure that their skin looks okay to proceed. So critical elements like that. There is an option that you would sit with the instructor, talk about what you missed and what you would need to do differently the next time. You could practice a little bit and try that practical exam again. For the online exam, again, you get the 2 tries. It is open book. If you take your time and can look through the book and really think about the questions, most people do well on it. After your first attempt at the online exam, you will get a report that says which questions you missed, and it would be the topic area. So I missed chest trauma. I missed a question in that, and then it will tell you not the answer to the question, but it will tell you the information that you would have needed to know to get the answer correct. So you will get that information if you do not pass the test on your first attempt. You can look at that information. You've got time. You can go back to your book. You can read through your book. It's really another, people hate not passing the test, but I look at it as you've got an opportunity to learn more. It's like, I didn't get it right. You're never going to forget that once you did it incorrectly. So it's a really good opportunity to really get it in your head, even though it doesn't feel good. And then you can retake the exam. If after the second attempt you do not get you it's 80% that you would need, you can retake the course. And there's not a time period where you have to wait. You could take it the next day. Things happen. We have bad days when you're trying to take a test and you might not pass it. So we call it the challenge option, but you would retake the course then to get another attempt. And there's not a waiting period. You don't have to wait 6 months or a year before you take it again. You could attempt it whenever you felt ready.
Okay. There is one question on how to take this course. So I'll answer that. You can take this course on our MedLern platform. So ENA courses are now available on MedLern platform. You can go to Store MedLern and look for the ENA courses there, and you can purchase it from there. Yeah. Then another question, will those contact us add any credit points? So this is something I would like to answer. So the users will have to check with their respective nursing council whether the credit points that are given by ENA are applicable to renew license from your respective council. So this is something that you'll have to check with your respective nursing council. Then another question, Katrina, is can you explain more about this instructor-led part if somebody takes the comprehensive TNCC program?
Sure. So I would imagine that would probably be virtual. So it's in exactly this setting. And the instructor-led component we take you through the initial assessment, and it's really it's with a lot of questions and answers. We have some games where we talk about, these are certain symptoms of certain head trauma injuries. So these are certain symptoms and you match it to, I think that would be a subdural hematoma, or I think that would be an epidural. So there's a lot of interaction. And then if it's a course that's larger than 6 people, then they have the scenarios where that's really taking each participant through the scenario. So it's a combination of larger group discussion, but with a lot of interaction. We really went away from, it's really fun for me to just sit and talk to people, but we know people don't learn the best that way sometimes. So if people have to think about answers, have to come up with answers, we have a game where you compete it's questions and answers, and then we can talk a little bit. So it's very interactive, but in instructor-led, the students work together as a team. Virtually, we use chat, we use again breakout rooms. There's a lot of different ways that people can participate.
Okay,
hope that answered the question.
And yeah, it does. And Katrina, are there any learning resources that go with the program? Like, if someone takes up this program, are there any educational resources that come with it for the user?
So for the trauma nursing core course and the emergency nursing pediatric course, there is a provider manual that it's a very comprehensive book. So you read that before the course, you have access to it after the course. And after the course, you can go back in and there is a video of that trauma nursing process. So we have 2 instructors going through a simulated patient case. You can go back and look at that whenever you wanted, if you wanted to refresh it. So you can always go back and look at the online materials, but the provider manual, the book is part of those courses.
Okay. The next question is for Terence. Terence, this question is actually from me. So I know that ENA membership is quite prestigious in the US. If a nurse here in India wants to become a member of ENA, what is the process?
Great question. I'm glad to hear someone's asking about that. There are several ways that we can do that. One, it's really going through our website. The other is what we would like to do is have some additional conversation with MedLern and look at how we may offer that through the platform, and perhaps maybe look at packaging it with a course that you might take. So we believe that being a part of your professional community that way and is really important. And with that, you do get quite a bit of resources that way for all sorts of things. And it really opens up the world to you and other colleagues. So it's a great thing. And we'd love to entertain conversation around that for sure.
Okay, and
there is an
Katrina,
there is an international community. We have quite a few international members, and they have an online discussion forum, so they can actually talk about specifically international issues. So we do have people from all around the world that join. It's wonderful.
Okay, and what are the benefits other than being able to do the courses? Are there any other benefits that the nurse would get if she gets a ENA membership? Some newsletters, some other resources that she would be able to access?
So one of those things I was mentioning, we've got online communities. So there's discussion boards. So if you are a bedside nurse, if you're an educator, you can ask a question. This is a problem we're having at my hospital. What do you do? And again, as we've gotten more international members, we're getting a lot of more creative ideas that we kind of only think about what we see every day. There's a lot of great ideas out there on how to do things differently. So you can post a question and you will get responses from all over the world from people that have dealt with the same problem. So that, and I look at that every day. I think that is a huge member benefit to be able to talk with other emergency nurses and dealing with the same problems. There's a mentor benefit. So we have people that are at varying levels. We have a community of fellows that have had demonstrated achievements and contributions to the emergency nursing discipline over the years. But you can connect with a fellow. I'm new to emergency nursing. I want to pursue research. I want to pursue becoming an academic. There are people that volunteer to work with people and talk with you. I can help you with your research project. I can help you. I'm interested in taking a course. What can you tell me more about this course? So they can connect one-on-one with other members too.
Yeah, I think a couple other things. Those are great, Katrina. One of the other real popular pieces is the Journal of Emergency Nursing. They get that with their membership, and it's one of our highest benefits that folks, that nurses are reading and going through. We also have a Connection magazine that comes out monthly. And again, it is tying you into things that are happening within emergency nursing and just sort of making you a part of that family, that network, that community. That I think is really important. And to Katrina's point about the community that she looks at it every day, even for a non-clinical guy, I look at it every day too. I'm just sort of fascinated to see the interaction, the questions, and where answers are coming from, and you're like, oh, so that's some of what they're doing in that part of the country or that part of the world. So it is very engaging. It's inspiring to be part of such a special community.
Yeah. So we are well past our time. So one last question, that is, what is a prerequisite for nurses in India to take up the comprehensive TNCC program? Is there a certain criteria that they have to fit before they can take up this program?
It's actually open to non-nurses. So you could be a paramedic or respiratory therapist, but it's the only prerequisite to become eligible to take the exam and become a provider, so have that verification status, is that you're a registered nurse or equivalent in your country of practice. So whatever is the equivalency of a registered nurse in your country, you are eligible to take the course. But anybody can take it and just get the education out of it, but to become verified as a provider, it's just to be a registered nurse or the equivalent in your country of practice.
Okay, so we would end our webinar here, and again, very grateful for ENA to take up time, and I know that time difference, it's middle of the night on your end, so taking out time to speak to our Indian nurses, and thanks so much. Thanks to all the speakers. Deepak, any last
Thank you so much. A great job. I think we got a great overview, brilliant questions, and thank you for your dedication for being up so late and helping us out. I look forward to a brilliant takeoff on the program in the country. Thank you so much.
Thank you, Deepak sir.
And thanks to all the participants.
Yes,
I would like
yes.
to thank all the speakers as well as the attendees. Especially for the attendees, if in case you guys have any questions regarding the courses, please write to us at info@medlearn.com and someone from our team will get in touch with you. And thank you so much for all your time. Looking forward. Thanks.
Thanks, Sujat. Thanks, Shubhashri. Thanks
Thanks,
for putting it
everyone.
together.